Role of computed tomography in the evaluation of the bone tumor. I am Dr. Tanvi Patel, second year resident student of the radiodiagnosis, working in the Government Medical College, Surat, under guidance of the Dr. Daksa Chavda, Associate Professor of the Radiodiagnosis. Introduction. Bone tumor, though relatively uncommon, present with the significant diagnostic challenges due to their wide histopathological spectrum and the overlapping clinical features. Differentiating benign and the malignant lesions are crucial, and management strategies and prognostic differs markedly. Conventional radiography is the often the first line management modalities. However, it has limitation in evaluating the complex anatomical areas and subtle cortical and the matrix changes. Computed tomography differs distinct advantages in the bone tumor assessment. Its high spatial resolution and the multiplanar capability allow the detailed evaluation of the osseous architecture, internal matrix calcification, cortical bridge, extent of the involvement in the adjacent structures. CT is particularly valuable in the characterizing the mineralization pattern, osteoid, chondroid, or the fibrous, guiding the percutaneous biopsies and the planning the surgical resections. Aim is to evaluate the role of the computed tomography in diagnosis and characterization of the bone tumor, and for the demographic profile. And to study the incidence of the various tumor. Objectives are to study the CT imaging features of the benign and the malignant bone lesion, to assess the role of the CT in evaluation of the lesion site, size and the margins, cortical integrity and the periosteal reactions, internal matrix, mineralization pattern, soft tissue expansion and the skip lesions. Method. The prospective studies carried out in the Government Medical College, Surat, in which 32 patients were selected who were referred to the Department of the Radiology, uh, which are clinically suspected the bony lesions in the plain CT, and the plain CT was performed. The inclusion criteria: patient with the all age group presenting with the suspected bony lesions on clinical or the radiographic evaluation, patients undergoing the CT scan for evaluation of the bony lesions, both benign and the malignant primary bone lesions, patient with bone lesions proven suspected on the histopathology, biopsy and the surgical findings. Patient willing to give the informed consent for the participation in the studies. Parameter assessed are the site size, margins, matrix, cortical involvement, periosteal reaction and the soft tissue extensions. Approach to diagnosis is: first we see the plain radiography, lytic or the sclerotic lesion, then the age and the location, whether it is long bone, axial bone, metaphysis, diaphysis, epiphysis, centric or eccentric. Then the miscellaneous are like solitary, multiple, periosteal reaction and the cortical disruption. Observation study shows the more chances of the bone tumor in the 11 to 20 age group and after 50 year of the age group. Where we can see the in the sex 68% are the male and that 32% are female are selected. Bony involvement is 56% are monoosteotic, 44% are polyosteotic, and the axial and the appendicular bony involvement, where we can see the 44% are axial, 44% are appendicular and 12% are combined. Giant cell tumor. A 40-year-old patient with the complaint of the swelling over the right wrist since 1 year, gradually increasing in the signs, no complaint of the pain or fever. The X-ray 1 year ago and after, at the patient present with the complaint now. CT findings: the large, relatively well-defined expansile lytic lesion with the few hypodense areas within it, suggestive of the hemorrhage, and few hyperdense trabeculae noted involving the epiphysis and metaphysis of the distal end of the radius, suggestive of the aggressive tumor, giant cell tumor. MRI reports also suggested a giant cell tumor. And chondroma: 59-year-old female patient, known case of the CKD, with the complaint of the shoulder pain since 1 month, well-defined lytic lesion with a narrow zone of transition with a sclerotic rim and stipple calcification within, suggestive of the chondroid matrix noted involving the left humerus head, possibility of the enchondroma, benign lesion. Osteoid osteoma: 17-year-old boy with the complaint of the right leg pain since 1 month, which is pain relieved by the NSAID. CT findings suggestive of the well-defined hypodense lesion with a small central hyperdense area, suggestive of the sclerotic nidus with adjacent reactive sclerosis and eccentric cortical thickening, which is eccentrically located in the anteromedial aspect of the right femur, suggestive of the osteoid osteoma. And first line treatment offering the rapid relief and the quick recovery is radiofrequency ablation. Chondrosarcoma, 51-year-old female patient came to the complaint with the localized persistent back pain with the progressive limitation of the movement with redness and warmth noted. Since 1.5 year, pain is worsened during the night. The CT scan suggestive of the large ill-defined expansile lytic lesion involving the posterior and the anterior element of the L2 vertebra with evidence of cortical breach and the resultant collapse of the L2 vertebra causing minimal sclerotic deformity with convexity towards left side. The lesion shows the large soft tissue component showing the ring and the arc calcification within it, suggestive of the chondroid mass and malignant neoplastic etiology chondrosarcoma. Bony metastasis. The 60-year-old female came to the patient complaint with a breast lump. On examination, hard lump was palpable. Ultrasound suggestive of the Biret's 4 lesions and further CT was advised. CT findings shows a lytic lesion noted involving D10 vertebra and the ribs on the left side, suggestive of the bony metastasis. Osteochondroma. 14-year-old boy came to the civil hospital with complaint of the chronic hip pain, inability to ambulate. He failed conservative treatment, referred to us after X-ray and CT scan revealed the osseous mass, diagnosed osteochondroma. There is 2 expansile bony density osseous lesion with the hypodense area within it, suggestive of the chondroid component noted arising from the anteromedial aspect of the neck of the femur and inferomedial aspect of the neck of the femur, possibility of osteochondroma. Osteosarcoma. 52-year-old male patient came to the civil hospital Surat with the complaint of the localized shoulder pain and arm pain, swelling since 4 months, for which X-ray was done. X-ray suggested of the periosteal reaction, periosteal new bone formation, noted giving rise to the sunburst appearance. CT finding shows the dense, predominantly sclerotic, new and radiating bone, suggestive of periosteal reaction, giving sunburst appearance, and the elevation of the periosteum, Codman triangle sign noted involving the left humerus bone, possibility of osteosarcoma. Simple bone cyst. A 40-year-old female patient came to the civil hospital with complaint of the trauma. After RTA, the incidental finding on X-ray was suggestive of the lytic lesion noted involving the right side ilium bone, and CT scan was done. The central lytic well demarcated cystic expansile lesion with the thinning of the outer cortical table and thinning and expansion of the inner cortical table noted involving ilium bone on right side, suggestive of the simple bone cyst. Summary and in conclusion are the after evaluating the 32 patient with the bony tumor using CT scan machine for 3 months, following conclusion are the obtained higher male preponderance ratio, higher incidence in the second and the sixth decade. Almost half of them involve the axial skeleton, half of them involve the appendicular skeleton. Most common bone involvement are femur, tibia and spine, with metaphyses are more involved than the diaphyses and then the epiphysis. Most common primary malignant bone tumor is osteosarcoma and secondary malignant bone tumor is metastasis, and benign tumor is osteochondroma.